Thanks. Got it.
Okay, great. Well, hello, everybody, and welcome. We are so happy that you could all join us tonight for a presentation and discussion about a comprehensive feeding approach for children with Down syndrome. My name is Corey Thomas, and I'm the new parent support coordinator for the Down Syndrome Association of Northeast Ohio. Also with us today from our Down Syndrome Association is our medical outreach director, Dr. Laura Sifrabine. And before I hand over the screen to Nationwide Children's Feeding Team and let them introduce themselves, I have just a few housekeeping items real quick. Um, we are expecting a relatively large amount of people attending this call, which is so great. We're very excited to have you all here. So if you could all keep yourselves on mute, that would be super helpful. Our group consists of both parents and medical professionals, which is also fantastic. Again, thank you so much for taking the time to attend tonight. Please feel free to enter your questions in the chat, and we'll be sure to try to answer them as best as possible during our discussion time that we're going to leave for the end. And we'll have everybody on the call kind of keeping track of the questions as they come in too. And lastly, we have a disclaimer slide that Laura is going to go over for us.
We want to make it clear that we're not here to offer any specific medical advice. This webinar is for information and education only, and it doesn't constitute a medical relationship between you and any of the presenters on this slide. And for any specific questions, then you would have to ask your child's healthcare provider. But this is just to have wonderful information and resources. So thank you.
Okay, great. Thank you so much. And without further ado, I'm delighted to turn the presentation over to the Nationwide Children's Comprehensive Pediatric Feeding Team.
Well, so I'm going to go ahead and pull my screen up here. Sorry, it's being funny. It did it when I practiced.
That's fine. And maybe I'll just start chatting about my stuff, Lauren, while you're
Thanks.
pulling that up. So I'll just to introduce myself quickly. My name is Rob Dempster. I'm a psychologist and the program director for the Comprehensive Pediatric Feeding and Swallowing program here. So I'll really be moderating the talk. So just as you throw questions in the chat, I'll be collecting those things. And also here, if there's programmatic questions or other things that come up, we have a large transdisciplinary team that also has medical providers, dietitians, feeding therapists, meaning speech or OT, nursing or chef, and all sorts of other people. So just as other questions come up related to other disciplines, I can also help answer some of those things. And just happy to be here. I did Northeast Ohio is near and dear to my heart. I trained at Kent State for 5 years and did my trainings at Akron Children's once upon a time. So really happy to be here as part of the group. Before I hand it off to Lauren and Kara, I just wanted to throw, if you'll put in the chat, we're trying to get an idea who the audience is here today. So if you'll put in whether you're kind of more from the parent side or more from the provider, professional side, and if you are from that kind of provider side, what discipline you are, they'll just give us a better idea of how we're tailoring some of the stuff that we're talking about. And again, if you have questions, throw them in the chat throughout. I'll try to keep track of those. So if we have time at the Q&A, those kinds of things, we're able to talk about it. So thanks for having us, and I'll throw it to Lauren.
My name is Kara Jordan. I'm an occupational therapist. I've been with at Children's Hospital since 2009, and I started in the feeding program in 2018, but worked in various other settings before that.
All right, and I'm Lauren Garbaz. I'm a psychologist on the team, and I've been on the faculty at Nationwide Children's in the psychology department for 10 years, and probably in the feeding clinic for about the last 5 to 6. I sort of did a gradual entry, and I've been working with the intensive program for most of that time.
Great. So and before you're diving in, Lauren, I forgot to mention as well, if you do have anything in particular that you were hoping to learn today, please throw that in the chat as well, just so we can make sure to try to tailor some of our other information that way as well. Thanks.
Yeah. Feel free to throw in the chat as well if you're a parent, a professional joining. It just kind of gives us a sense of who's here. All right, so the three of us do not have anything to disclose other than being employees of Nationwide Children's Hospital. And Kara and I are really going to do the bulk of the presentation, and Rob Dempster's here to facilitate, questions in the chat and sort of act as a discussant after the talk. So we have a number of things we're hoping to share with you tonight. We'd like to touch base on the basics of what pediatric feeding disorder is, and then how our particular clinic comprehensively manages complex feeding problems. And finally, we're going to leave you with a few places to start that we consider to be foundational in treating feeding disorders. But for time reasons and just the complexity that can happen when we start talking about pediatric feeding disorders, we won't be able to go as in-depth as we would really like to in many of these areas. But as I mentioned, we'll share a couple of resources for courses, both aimed at families and at professionals to go more in-depth on many of these topics, including additional ones that we won't cover here. So to just start off, what is pediatric feeding disorder? We hear feeding difficulties. Sometimes we hear picky eating. What does this, really this medical term mean? On the surface, it could be simple. A child isn't eating enough by mouth, but it really, in reality, it's quite complex. So this diagnosis often involves, as you can see here, medical, nutritional, feeding skill, and potentially psychosocial challenges. That also encompassed in psychosocial challenges can be the behavioral challenges that come particularly with younger kids, but really kids of any age who are interested in eating. How do you get them interested in it, or how do you get them to practice? So all of these factors tend to interact and combine, and that makes pediatric feeding disorder quite complex to treat comprehensively. Oftentimes only one or a few of these areas get looked at one time by treating providers. So it's can be kind of siloed. And so tonight we're really going to talk about what it takes to, in our experience, to treat pediatric feeding disorders truly comprehensively. So I'm going to now hand it over to Kara to discuss how all of these complex challenges may play out specifically for a child with Down syndrome.
Okay, so these are all common feeding challenges or complications that make feeding challenging for children with Down syndrome. These factors interact to make a complicated picture. So for example, if you have low muscle tone, then this will affect your ability to coordinate the muscles in your mouth. Low muscle tone also can make you prone to constipation, which may then affect your tolerance for eating. If we get tolerance issues such as belly pain or vomiting, this can make kids not want to eat and can lead to behavior challenges in the meal. And then if there is decreased oral intake, then that makes it challenging to work on oral motor skill development. So you can see this gets complicated really fast.
Okay, so because of all these overlapping factors we've discussed, we really need a whole team of people working with the child. And we also need to be able to work with each other. So you can see these different disciplines overlapping because we really do need to coordinate pretty closely together as professionals as well. And to make it even trickier, as we've kind of alluded to, these factors can all overlap and interact with each other, and they can also change over time as a child grows and changes in terms of their developmental skills, their cognition, things like that. It can throw different challenges at you at different times. So treating a feeding disorder really can be a long journey. And I'm sure Corey is going to touch on that a bit as she talks to you from a parent perspective later tonight. And not pictured on this slide are other members of our staff that are equally as important as these treating providers. So we also have incredible administrative support, a couple of culinary technicians who work in our kitchen, a child development specialist, and an increasingly large nursing staff. So truly, we all play an important part in a child's feeding journey. So I want to, just talk about some of the levels of service in our clinic so that it kind of makes sense how we treat feeding disorders. There isn't a one size fits all. So every child that comes into our clinic, and this is likely true other places that have feeding teams, every child starts with a team evaluation to look at all the complex factors that are involved in their particular picture. No two children with a feeding disorder are ever the same. You could say the same thing about, any diagnosis, Down syndrome, autism spectrum disorder. You really need to look at each child and their particular factors individually. And then that allows us to take that individualized approach that's needed. So each discipline or specialty that I just showed you on the previous slide is part of our team evaluation. So medical provider, dietitian, feeding therapist, to look at skill, a psychologist to evaluate behavior, and our invaluable and unfortunately lowly one social worker. But he's really helpful with insurance and all of these factors that are crucial to getting the right care. But if we didn't have him, those pieces might fall through the cracks. So based on the evaluation, once we have a grasp on the complexities involved in a child's presentation, then we can identify starting points for outpatient treatment. And we can make recommendations for how treatment, especially if it's already ongoing, how we may think about focusing or refocusing treatment based on some of the complexities that we've kind of put together, almost like pieces of a puzzle. This could be feeding therapy to work on skill. It could be behavioral therapy to work on just kind of acceptance and the behaviors that can come up when you're trying to ask a child to eat and they don't want to. And then everybody in our clinic after an evaluation would also get followed medically and by a dietitian as well. But many people come to us just for our highest level of service, the intensive program. And then many children may do outpatient treatment for a little while. And if it isn't an intensive enough level of service for them to make the progress that their families want, then they may consider our intensive program. Kara is going to walk you through on the next slide, a couple of slides, what each of these levels of service looks like in our particular clinic. So you can kind of get an idea of what it would be like to walk, can go through this process.
So first, let's walk through how our team works together to provide that comprehensive evaluation. So each part of the feeding team will evaluate at a time in pairs. So the medical provider and the dietitian first, followed by the psychologist and the feeding therapist, and then finally social worker. The rest of the team is watching for the whole time from the conference room through a one-way window with a speaker. So we can hear everything that the other disciplines discuss with you. Once the feeding team has had a chance to complete their assessment, we will bring the family around to the conference room to create and review a comprehensive plan for your child. And then from here, referrals can be made to outpatient services or the intensive program as appropriate. We also work with families who aren't local. So they may be visiting us specifically to do the intensive program, and then we may help manage their feeding disorder from a distance until they can do the intensive program eventually. Okay. Slide. So our intensive feeding program is an outpatient full-day program, Monday through Friday, 3 meals per day, and 6 to 8 weeks. We have a lot of different parts that go into the intensive program. This slide shows examples of our treatment spaces, and I can tell you why each part of treatment is essential to a comprehensive approach. These kids are with us all day for up to 2 months. So our nap room, fortunately, we are able to give them their own space during their admission. For the observation room, the family observes from a one-way window while the therapist completes the meals for generally the first half of the program. This is important for the caregiver's learning and preparation for caregiver training and eventual transition to home. In the treatment room, the feeding therapist is completing the sessions initially and eventually will bring the parent into the room for caregiver training. We want to teach the skills first and then go home, have the family go home and do this. In the kitchen, each week the family will participate in meal preparation. This is where they will learn to prepare and make the foods that their child will be eating when they discharge from the program. And then we also have a family lounge. This is where patients can play with toys or do special projects between meals. They may also spend time with our child development specialist in the lounge while their parents are in meetings. This is also where we hold graduation ceremonies at the end of their admission, especially if the weather doesn't cooperate and we can't do it outside. So next, I'll hand it back to Lauren to talk about how we approach starting treatment, whether it's in the intensive program or through outpatient services.
Okay, so many of you attending this talk have probably been in this position. Here's this complicated thing in front of us, and it's constantly changing because kids never, do anything for very long before they switch it up on us. So where do we begin? Well, our foundational piece, and this is true when kids come in for an evaluation for us, is first and foremost, we're really going to be evaluating their growth and their nutrition status. This is primary. We want to keep their precious little brains growing and providing, the body with everything it needs. So we're not going to make a lot of recommendations on challenging children in therapy until this is really really stable. The other thing and we'll go into each of these in a little more depth. The other thing is we're going to really look at the child's positioning. And Kara will really talk through why that's so essential, but that can often be a missing component when kids come in to see us for an evaluation. And I've had so many parents tell me how amazed they are at the difference just because they've made a change in the child's seating when they're trying to feed them. We also are going to talk about matching feeding tasks to developmental and skill level. If we have a mismatch there, we can often get less motivation for children to eat and a lot more behaviors. So that's a key thing we're looking at. And then we also try to, we're going to, be thinking about some initial ways that we can manage behavior and make sure that we're really getting mastery of foundational skills, which again, I'll go into in more depth. So first with growth and nutrition, again, we want that stable growth before we're challenging kids in therapy. And another component of this is really making sure that they're tolerance for what goes into the GI system is as optimized as it can be for where they are in their developmental level. Some kids just need bigger anatomy before this gets better, but as much as we can treat the underlying reasons for the vomiting or adjust how we're feeding a child to minimize the vomiting, obviously that's going to help with better growth and nutrition and stabilize that. And it also just helps with motivation to eat and participation as well. And then we're going to really look at how we balance volume versus variety goals. This can often get really mixed together. I want my kid to eat more, but I also want them to eat a lot of different things. And it can be challenging to work on both of these things at once. But when we have a whole comprehensive team and we're really thinking about growth and nutrition as primary, that can help us to prioritize at different times. When are we going to push on volume versus when is it most important that we think about variety? And can we take the pressure off variety by making sure nutrition is stable in other ways, such as formula or multivitamin? So we really work as a team to help meet parents' goals and also be helping them make decisions about how to prioritize and when. And then finally, we're really looking at how we can establish and maintain a mealtime routine. That word is important. Routine is essential for kids. That's going to help with better behaviors at meals. Everyone knows what to expect. And we want to make sure that is supporting their nutrition first and foremost. And I'm going to hand it over to Kara to talk about where a child's sitting when they eat.
Well, as Lauren mentioned, a foundational starting point of treatment focuses on postural support early on. If the child doesn't have adequate support, then it makes it hard to, they can't isolate their facial muscles well, so it makes it harder to eat. These are examples of commercial seating options that we have in our clinic. So these seating options are not meant to be recommendations. So please refer to your feeding specialist for optimal positioning recommendations for your child. And then the medical provider can refer a child with more complex positioning needs for durable medical equipment if needed. So it is important to remember that feeding is very much a developmental skill, just like walking or talking. There are many important aspects of development to consider when it comes to feeding that your feeding specialist will need to address. Sensory motor development in feeding is a complex multi-system process where the infant learns to integrate sensory input, so touch, smell, taste, with motor skills. So chewing, swallowing, sucking. If they cannot feel where the food is in their mouth, then it can make it hard for them to coordinate the muscles that they need to chew and swallow. And then weak oral motor skills can also interfere with the ability to eat and swallow safely and efficiently. Weak oral motor skills often is also indicative of decreased endurance or stamina and ability to sustain attention for the entire meal. So breaking down more complex tasks and practicing skills over and over can be helpful for a child with Down syndrome. We want to make sure that the expectation is clear and that this is something that they can do. So let's look at some tools to do this. So we mentioned breaking down tasks for children with Down syndrome. Examples you can see here are therapeutic spoons that help with tongue positioning, a probe to teach the child how to move their tongue, and then a transitional drinking device that we use to teach either open cup drinking skills or straw drinking skills. So these tools can all be used to facilitate complex mouth movements required for eating and drinking efficiently. And children with Down syndrome often need to be taught these movements through modeling and direct instruction, and then be given many opportunities for supervised and repeated practice to master these skills.
And I get the joy in my job of getting to sit with parents and of processing what they're watching, especially in the intensive program, as children are learning to do many of these things with a therapist. And I will say over and over, at some point, parents' minds kind of get blown. Like, I had no idea that eating could be broken down into such minute steps. And that so much was involved with eating. But oftentimes it requires that kind of breaking down of tasks to help children really start to master it. So in that vein, Bill, one of the things that we often talk about when we're starting treatment is that if we do not have a really strong foundation that we're working from with the child, that could be a routine, that could be trust, that could be mastery of essential basic skills. All of that goes into building a really strong foundation that we can then build on. And it's just like a house of cards. If we have a strong base, we're going to be able to build up without everything falling down. And so we take our time in the beginning to really make sure that foundational skills are mastered before we're expecting a child to do the more complex things of managing food in their mouth. So we don't even start with food. We start with being calm, sitting in a seat, particularly if a child doesn't love to have those shoulder straps on. For proper positionings, especially with low tone, we got to have those shoulder straps on to isolate those face muscles. So we really make sure they're comfortable sitting in that seat, that they're tolerating some oral stimulation. If their sensory motor tolerance is so low that they don't want anyone coming near their face or putting anything in their mouth, that's going to make teaching these skills really challenging. So we have some desensitization exercises and just moving slowly with kids that things that we can do to help build their tolerance for that over time. And then we're really working on foundational skills of what happens when that spoon comes to your mouth. If we first load it with food and expect them to not only manage that when they haven't even really practiced how to get that spoon in there, that's too many things at once. So we start with just a dry utensil and really learning how to open big enough for that, learning how to tolerate where the spoon is on their tongue, learning to keep the tongue in the mouth, things like that. And then we really make sure they understand being able to get rewarded for something. This is a teaching tool. It is, I mean, yes, we want it to be fun and we want them to enjoy their time while they're working on these things, but we also, it helps them understand, oh, that's what they wanted me to do. They gave me those bubbles I love right after I pulled my tongue in my mouth. So when they do that and they say good tongue in, that means I should keep doing that. So that really helps them learn. And finally, we're really working on lip closure. So we might break things down to the point where the spoon just has to go in, but they don't actually have to close their lips fully on it until they're ready to put all of those complex movements together. And as I mentioned, we also just really want to make sure we're positively reinforcing the behaviors we want to see. Not only, sitting calmly in the meal and participating, but also those really small oral motor movements that we are trying to develop and build. When we really reinforce those things specifically and in ways that are engaging for the child, then they learn how to continue doing those things and build on them. So we want to make the rewards immediate. And we want to label that behavior specifically using our language or maybe even kind of showing, with our fingers or something, what we liked that they did. So we've got a few key takeaways here that I will hand over to Kara.
First, we want to emphasize how crucial early intervention is to address your feeding concerns. And just remembering that it's important to have small and realistic goals that are achievable that you can build on over time. So the foundation that Lauren mentioned is a great starting point. And then given that feeding difficulties have multiple factors and considerations, we recommend finding an integrative and comprehensive treatment team for support. So really rely and use your expert feeding team for resources and guidance.
All right, and we did mention some resources for a deeper dive. This is our the latest course, I guess, coming up that is designed just for families. Professionals can also join it. It's a great way to learn more and especially to get that perspective of what your families may be going through. You can sign up for one of them. You can sign up for all of them. They're all sort of individual topics. You don't have to go to any certain number of them. You're welcome to scan the QR code here and it will send you to a registration page and give you a lot more information about this. And then we do have another course for professionals that we run once a year. That one is longer and it is designed to be more of a series where you're going to it from start to finish. I believe it now has, is it 10 sessions, Rob?
Sorry, unmute took me a second. Yes, it's about 10 sessions, and I think we're anticipating that we're in the middle of a series right now, and so that will start back up at likely the beginning of next New Year. So in 2027 would be the next one.
Yeah, so if you're a professional, you want something sooner, feel free to join the family one. We'll still be sharing a lot of similar information. We just approach it a little differently with families. I was going to say something else about that. But anyway, thanks for dropping that in the chat, Rob. I appreciate that. I was going to just mention, these are free. So no payment involved. But this family one, again, does not have CEs. The professional one that'll start again in the fall will offer CEs for pretty much any discipline that would want to attend.
And Monica, to answer your question in the chat, yes, those can be recorded if you can't join them. We go, families are busy or somebody starts yelling in the next room and you got to pick up and run. So there's definitely resources available to look at after, as well as recorded versions of those presentations. Great. Well, Lauren and Kara, I know we want to leave plenty of time for Corey's presentation, but if we have just a minute or two here, the biggest question that came up in the chat in a variety of ways is, my child is either only eating a couple foods or they were eating more foods and became picky, and trying to figure out how to get them to eat more than kind of the 3 or so things that they eat. I put in some broad strokes on the slides that you were talking about with trying to find a goal that's meeting with them where they're at, that may or may not be food, when you're talking about dry spoon and things like that. But other comments you'd make on kind of working with selective eaters?
Yeah, I always think about skill versus preference. And so sometimes kids have a preference simply because of where their skill level is, and something may feel too difficult for them, but it's hard for us to know that. So Kara can definitely speak more to that, and may let her talk about that. And then if that's not the issue and it's just purely a preference thing, I can talk about that from a little bit of a different perspective.
Yeah, I think it just goes back to kind of what we mentioned with, making sure they're in a good position and what do their skills look like? Are they trying to, they may want chicken nuggets and they may be trying to eat them, but are they using maladaptive patterns? So, really looking at like what their skill is and what they're safe for is important when considering what these preferences are.
Yeah, and then if it really is a preference thing, kids can be picky in such a number of different ways. It can be about texture, it can be about taste, it can just be rules they've created in their head. Again, hard to tell sometimes, but if you can start with something they do accept and kind of branch from there a little bit, and maybe not try foods that are wildly different, sometimes that can help. And other times it just takes working with a professional to learn how to get them exposed. Kids need to try foods up to 30 times before they even know if they like it. And if they don't make a snap decision about it after the first or second time they've tried it, it's hard to get them to keep trying, but that's really what they need to do to learn to adjust to it. And psychologists in particular, are able to provide you with some individualized strategies for how to keep a kid coming back to something they may not love right off the bat.
And for at our institution, it tends to be psychology that's working with the more selective eaters, and feeding therapy that's working with more of the skill. But that's different at different places, depending on where you're getting treatment. And so, in our world, there tends to be sort of a more like child-led approach to working on new foods that more often comes in the therapy world, but isn't always. It can be there for more like introducing ways to kind of explore things, seeing. But then we have some kids who they try that approach. A family tries that for 6, 8 months, and we're still not getting to the point of kind of putting anything in our mouth. Then sometimes a more structured approach, and that's usually what we get with our psychology team, can work on gradually meeting them where they're at. And so part of the reason why we brought up kind of meeting them where they are and starting with those small steps is if they're not even ready to accept a like non-food thing or a small task, that's really where they're at. That might be more on that kind of more behavior side. Whereas if there's some interest, some exploration, but still nervous there, might be able to do either or. So it's not a one size fits all. So just because one area doesn't necessarily work as well, the other might also help if you're trying to get your team together there. Great. And want to make sure we have time for Corey's presentation here. But so and there's another question we have about hydration, but I'll earmark that so if we have time after the presentation, we can come back to that.
Perfect. Thanks. I'll stop sharing, Corey, so you can take it away.
Okay. Thank you. Okay. Well, thank you again to the Nationwide Children's Team for such a thorough explanation of pediatric feeding disorders. I know it's a lot to learn, it's a lot of information, and highlighting how your program may differ from what many of us have experienced in this specific area of need here in Northeast Ohio area. I'd like to take just a moment, if I could, to offer you some details, maybe a little extra color just from a parent's perspective, in the journey that I'm currently on with my daughter, Faith, and her nationwide feeding team. I want everyone to remember, though, everybody's journey is unique when you get started, and what the challenges are. I mean, they can vastly differ. So this is just, my perspective of where we're at in our journey. A little bit of background for Faith. She was born in 2017, so she's 8 years old. She was a prenatal diagnosis of Down syndrome, and we struggled with weight gain and reflux from birth. At the time, even though it felt difficult, I didn't give it too much thought because I had almost the exact same experience with my now 18-year-old twins when they were babies. So for the first few years of her life, we just tried different formulas, reflux meds, feeding positions, volume adjustments, and we were able to kind of tread water for quite some time. But any illness would always land us in the hospital for dehydration, and then we would have to start all over again. And that was kind of our song and dance for, what felt like forever. And then when we started to introduce solid foods or anything that had textured purees, we seemed to just reach like a plateau, and we weren't advancing like I did with my other children. So then the flags started to come a little bit quicker. We saw lots of refusal, spitting up, vomiting. It was a lot of anxiety for not just Faith, but our entire family. We tried a lot of outpatient therapy. We would go once a week to OT therapy services that focused on feeding for a few years, with minimal progress. We also tried, I think, a few programs that were labeled as comprehensive, still outpatient type of therapy for feeding, and which just unfortunately ended up being kind of a dead end for us. So, and most parents, almost all of you on this call will appreciate, like, feeding was not our only therapy, right? So you have speech and you have, OT and all the other things in physical therapy that you're trying to do. So for a long time, we would plug into feeding, and then we would tread water some more, and we'd give physical therapy, more of a front seat because we wanted her to walk. So it was really hard to balance and give, feeding all of your attention all of the time. Plus, it was super stressful, and we needed the mental break of it all. So in my mind, I just kept saying to myself, eventually she's going to outgrow this. We'll have it figured out by the time she goes to full-time kindergarten. And then it was fall of 2023 is when Faith started kindergarten. And she was still drinking Pediasure peptide from a Dr. Brown's baby bottle. 100% of her nutritional needs were coming from that formula. She had a 1-to-1 para that would take her into a separate room and have lunch and give her baby bottle. And I felt quite defeated. I wished we were further along at that time, but also, in a state of acceptance that this is where we were, and she was being nourished, maybe not in the manner in which I had envisioned, but that was where we were. So I had heard of intensive feeding programs, but I wasn't aware of any that were near us. I asked our GI doctor, and he had mentioned that he thought Nationwide still had one. I called and scheduled an evaluation, and just like they described, the team came in and evaluated Faith, and they felt that she would benefit from their 8-week intensive program. But as a family, we were not able to make a commitment like that at that time. So we kind of settled on an outpatient co-treatment program. And then in 2024, we started services with Nationwide. So we would meet with a psychologist and a feeding therapist, sometimes together, sometimes separate. And then she was also overseen by a medical provider and dietitian. And we did that for a little over a year. We traveled to Nationwide 1 to 2 times a month for in-person therapy. And then we could also do like some virtual follow-ups in between those visits. In all honesty, I was very skeptical of the program, mainly just due to our past experiences and how we just kept struggling so much in this particular area for Faith. So I definitely needed to do this in this manner for me to even consider the 8-week intensive. So this worked out perfectly for where I was in this journey with Faith. Some of the key takeaways over the course of that year of the things that we learned that kind of made me a believer, that this was going to be different. One of them was just that ability to, they described it, break down all those little tiny components of why Faith struggles with feeding. And it was so many things. It was so many things I hadn't even thought of. I thought I knew of all of them. I thought I knew the big ones, but really breaking those down and then building strategies to address every single one of them. At first it felt kind of tedious and drawn out because honestly, I think in my mind, I completely like misunderstood what a true comprehensive program really entailed for it to be successful. So that high level of consistency that they started building in from like day one, the routines, the repetition, the reward system, every part of her plan was meant to be predictable and safe in order to build confidence so that we could advance. And that was such a critical turning point for us because my confidence was low and Faith's confidence was low. So we really had to kind of build that back up so we could learn to rely on each other and trust each other. So building that back up in that manner, I mean, to this day, she knows the routine so well. She'll tell you when you've done it wrong or you've given, a third bite when you should have started with a drink. And she'll correct you because she really relies on that. And you can tell her anxiety would come down and she would be more willing to accept the next step that we were trying to push her towards. So that was helpful. I think Kara mentioned, setting realistic goals. That was critical. We would all agree, in clinic on here's the tasks that you're going to do when you go home and work on maybe these two things. And I would get home sometimes and what I thought we could do in our schedule, our very busy schedule, I have 2 other kids, I couldn't do. And instead of like kind of waiting on that struggle bus of, oh, this isn't working and we're really struggling with these 2 things we were supposed to work on and waiting like the 2 weeks until you would see your therapist again. Like it was just a quick email, a my chart, a video that you would snap and you would get, real time feedback, how to adjust something and be put in a better situation or direction on whatever it was that you're working on. And so that was really helpful to be able to get that feedback so quickly in between visits. So yeah, seeing is believing. We were making progress that was sustainable for the first time that I could really rely on. So I was getting more and more excited for the next appointment, like what are we going to work on next? And then basically about a year in, I was confident that the 8-week program was going to be able to help her advance her feeding skills much quicker and more efficiently. So we became like the process of getting on the wait list for the intensive. June of 2025, so last summer, is when we started the 8-week program. It was a total game changer. It was a huge commitment. It was a lot of work. Overall progress was definitely accelerated because of the high frequency of those therapy sessions. We moved into the Ronald McDonald House in Columbus and stayed there Monday through Friday for 8 weeks, and we came home on the weekends. I live in Medina, Ohio, so we were just under 2 hours to get home. And a typical day would be to arrive at the clinic at 8 a.m. and we would have 3 scheduled therapeutic meals a day. And in between those meals, we could go back to that room that you saw a picture of and we could rest, we could play, I got some work in a little bit. I'd feed myself and our days would end, I think, around 3:30. And depending on the day in between those meals, Faith would go to the playroom with the child life specialist, which she absolutely loved. I mean, the kid thought she was on an 8-week vacation most of the time. And I might have like a family meeting. So the team would meet once a week for the family meeting where everybody was in that conference room, everyone they just talked about in the presentation. So the psychologist, the feeding therapist, the nursing staff, the social worker, the dietitian, and we would all go around the table. My husband was able to join those remotely if he wasn't there in person. My mom did as well, so everybody could hear the weekly feedback of where we were at. That was really awesome that they could do that, and I didn't have to retell the meeting because That's really hard to do because it's a ton of information. And at the end of the day, you are exhausted from the work that you've put in. So that was helpful. The psychology meetings one-on-one were also helpful. Meeting with the social worker and then getting into the kitchen with the chef and going over the foods to prepare so that when I came home, I was able to hit the ground running and pick up right where they left off. So that comprehensive approach that I just described was nothing like we had ever tried before. Um, so in the beginning, just to kind of put a little context to when Faith would have her meals with the therapist, Lauren touched on this a little bit. I would be behind that mirror watching, and Lauren, Dr. Garbaz, would be sitting right next to me, and she would be in real time describing what was going on inside that room with Kara. And so the exercises they were working on, the meal they were working through, those could be stressful. I mean, I was a nervous wreck watching your child be nervous or struggle with something or get sick. All of those things were happening. Behaviors were happening. And in real time, Lauren was able to describe, this is what you're seeing. This is why we do this, and kind of breaking down things that I never understood before. These were things I've seen. They were a little bit heightened, obviously, because of the context, but I never understood the why. And being able to hear a professional tell me this is why your kid was struggling just made you understand the process so much easier so that you could help your child. That was really, really helpful. And then eventually, I would find myself in that room, maybe off to the side, not having anything to do with the meal. It was still Kara running the meal, and I was just in the room. I would have to divert my eyes a few times and not make eye contact until we worked through some behaviors. And then eventually I was at the table, again, just sitting at the table, and the meal was being run. So it was just these tiny little tweaks that just built, to me being at the table. Now the therapist and psychologist are behind the mirror, and I have a bug in my ear, and they're talking me through the whole meal, talking me through behaviors, what to do, giving me encouragement and support because you are nervous and you want to do well. So all of that support, I can't stress enough, was just so critical for me. I mean, even 2 weeks into, like, we had about a week and a half, 2 weeks left, we brought in two of my family members, my husband and my mom, and they did caregiver training. So that was also very helpful and appreciated because this whole time for Faith's entire life, I felt like I have carried this feeding burden on my shoulders alone. And that's been really, really difficult. So knowing that two family members that would be able to feed Faith when we got home and outside of the nationwide bubble would be trained by the same professionals and not me relaying it to them, it just worked so much better. And they would get in the room and they would make mistakes, and they went through the same process, and they would get, corrections and help and advice. And it wasn't coming from me, which was a beautiful thing. So I don't know about you, but if you've ever come home from a therapy session, you try to retell it to your family and tell them that what they're going to do, and nobody listens. So that was my reality. So yeah, a lot of changes, adjustments were made daily. And all those little tweaks, a lot of things that have to do with the gut. We had constipation issues, lots and lots of constipation issues, and they came up with a plan for everything. Like, there was reality built into it. I mean, Faith got sick while we were there. She got strep throat. We had a sick plan. So we back off on the overall plan, and here's her goal when she's not feeling well. So I even felt like even at home when life happens and your child gets sick, now what do we do? I just felt very supported, any which way, basically, and to date, Faith has made such progress that has stuck. It's sustainable, and we're continuing to move the needle for her. And I'm just so excited. To name a few, she is not drinking out of a Dr. Brown's baby bottle. We've actually advanced from that squeeze straw bottle recently. She is solely taking all of her drinks, water and Pediasure, through a take and toss straw cup, 100% independently. She's eating a variety of pureed foods like chicken and mashed potatoes, peanut butter and jelly, peaches, pears, cereal, sweet potatoes, chicken soup, a variety of yogurts, applesauce, just a ton of variety. All of her medications she now takes by mouth because we worked on her oral motor skills and desensitizing her. I used to have to hide them in her milk. She's able to take those now. So now I don't have to hope that she finishes her milk to get her medicine. So I feel like I'm able to care for her way more efficiently when it comes to getting in medications. So she's meeting her nutritional and hydration needs on a daily basis at home and school, which is just, I mean, it's such a huge milestone for us. And I never thought I would be able to say that she's having 3 balanced meals a day with real food and a drink in under 30 minutes. This journey definitely will be lifelong for us. And we will be headed back in the summer, hopefully for a few weeks to specifically work on chewing and textures and solid food. But this time I just feel like we're in such a better place because of these foundational skills we were able to build in that even when we hit a roadblock or a blip, happens, we don't fall off the map like we used to. I'm not packing my bag to go to the hospital, knowing that we're going to need fluids for hydration. And that is such a peace of mind that has come out of basically the whole program and where we're at today. We have hope for the future, and I'm super confident that she's going to continue to grow as an independent eater, and I'm just super excited about it. And I can't thank the Nationwide team enough for helping Faith personally and for doing this call. Obviously, you guys can tell I'm very passionate about this, and I work for the Down Syndrome Association and support new parents. And when I left this program, and I think even during the program, I used to tell Dr. Garbaz, like, we have to get this information to our families. This is just something that I know is going to help people and just give you an idea of other ways and other things to look at and other resources. And so I would be doing you all a disservice if I didn't make this happen and get this information to you. So that is our story so far. Thank you.
Awesome. That is so inspiring. And I didn't know that you're a feeding nerd when it's like take and toss cup. Yes, like that's a home run, but oh, that's great. We have some questions in the chat kind of broadly about the stuff, but any questions or comments for Corey before we move on to those? All right. Well, one thing I just wanted to comment, there were comments in the chat about sort of like how you link providers and what do you do when your team isn't as gave an example of the intensive is kind of the most integrated level of things that we do, but what do you do when your team is spread out and not so integrated? I think one other thing that I'd encourage you, if you do sort of have to have these disparate areas that are there, is ask if you're advancing on a certain treatment goal, what some of the trade-offs might be. So for example, when we're talking about a lot of families want to work on chewing, but also have the same goal of working on weaning from G-tube. Well, if you focus more on chewing foods, you're going to eat less. So it might be the trade-off might be we spend longer or have higher amount of tube feeds. For some families, that's okay. If you can eat a couple of bites of chewing food at Thanksgiving or something like that, that is ideal. But for others that want that, it might be there. So if you're kind of seeing those things, making sure to be explicit and talking with some of your providers about those or other people that we might want to loop in. Might be one thing. Karen and Lauren, any other thoughts on kind of forming your team if it's not such a like kind of integrated example as what we were just talking about?
Yeah, I think it certainly can be tricky. I saw some really good tips you gave in the chat about making sure you're asking people to clarify if recommendations feel at odds. There can be different approaches that people use. There is definitely not one way to treat feeding disorders. There are times that, we have families who are in treatment and it's maybe more of that child-led approach. It hasn't been working super well from what they tell us, that's what they've shared. And then we say, well, this is how we approach this. And we just sort of say, what feels right to you at this point? And maybe sometimes we don't stay with a treatment team where things are at odds. We find, providers who are kind of thinking in a more coordinated way. So you're not feeling stuck in the middle. And really, ultimately, we want parents to be empowered to pick the way that is going to work best for their child at any given time. So we really try to just educate families on like, here are the different approaches and why people might use these different approaches and, why it might sometimes work and not always work. So I would say just try to have open communication with your team and ask questions and, don't be afraid to be an empowered advocate for your child.
Great. And then another sort of kind of side question came up about what do you do when you're working with somebody who it's really about the drink, they're not showing interest in those kind of hydration needs, and how we work on sort of getting to drink more consistently, even if the eating part is going okay.
We do
And,
have a
I
lot
think,
of our intensive program. Kara probably can share a little bit about how we get kids going on that. We use a lot of structure and routine, as we've talked about. So.
Yeah, it's a very predictable and systematic way to introduce, whatever that novel task is or that non-preferred um, thing that we're asking them to do. So we typically start with, whether it's if you're talking about hydration, it might be a drinking device that we can teach them the skill and just, even having it on the table for visual exposure prior to, once they tolerate that, then being able to bring that to their mouth, and just even tapping their lips to start, really labeling and praising when they start to open, even if we're not going in yet. And then eventually being able to go in with that empty drinking device. Sometimes we even have to bridge the gap. We might have to put the formula or whatever even if it's water for hydration into the drinking device, without giving them drinks right away. So it's broken down into, very small steps. Really depends on how the child responds and how fast we're able to make progress, with getting them to actually start taking drinks. And then once they're taking drinks, there are different ways that we can structure it, whether, if they're not taking very big drinks, is there a way that we can pace their swallows so that they're start to learn to coordinate successive swallows? Or sometimes we might have to implement like a drink minimum to teach them consistency with drink sizes or things like that. So there are lots of strategies. And like Lauren had mentioned too, there's so many different ways, and not a one size fits all. So it really just depends on the child and their skills and their responses to what we're asking them to do and how we modify the treatment for them.
And then what makes all of that skill development successful in the background is being linked in with a dietitian who is able to help us with kind of scheduling out their hydration. So, as they take a little bit more, is there a way to kind of wean back on the other ways they're getting their hydration, maybe through a tube? And, can we kind of slowly build their stamina and getting them used to taking more hydration, and then back off those supports.
thanks. And I'm just putting the link back here again for Family Echo. This is sort of an outreach where that can be done piecemeal, just for if you want a little bit of a deeper dive on these topics. Since people brought up selective eating a bunch, that lecture on the website, it says April 11th, but it's actually on April 22nd. So I put that in the chat just so that it would be in there, and didn't know that until this moment. So I will make sure that's corrected. Oh,
there are two.
Yes, but even that date is incorrect. So we'll fix it with Amy.
Get that corrected.
Yep. But that's April 22nd, especially for the younger kids that were mentioned in the chat. And just thank you all for inviting us. There's folks from the Cleveland Clinic program on here as well, and we worked with folks at Akron, so we're definitely not the only kind of interdisciplinary feeding program around. But if you do have questions about like intensive or our services or helping with link with other resources, feel free to reach out to any of the three of us, and happy to kind of help with things or problem solve or anything like that.
Yeah, thank you all so much for having us. We just are really passionate about seeing kids learn these things and get better and do better and build and supporting families along the way. And Corey's perspective has just been a treat for us to hear as well. It's incredible what families do for their kids and all the work they're able to put in. It's really inspiring. Thank you all.
Thank you. We really appreciate you being here and sharing all your resources with us. So thank you. Have a wonderful evening, everybody. I appreciate all your time. And look at that. We did that in an hour. Good work. All right.